It's always a treat having a podcast conversation with one of my clients. Sometimes the impact of a depth psychology approach is so striking, my clients want to share it with you. In this case, the chat with my client bridges the personal, professional, and collective. Today, I'm excited to introduce you to Gretchen Ames. She holds a PhD in clinical psychology from the University of Florida. She joined the staff at Mayo Clinic in Florida in 2007 as the psychologist for the multidisciplinary bariatric medicine and surgery program. Gretchen is certified in clinical health psychology by the American Board of Professional Psychology and holds the academic rank of Associate Professor of Psychology in the Mayo Clinic College of Medicine and Science. As an adjunct professor at the University of North Florida, she teaches undergraduate health psychology. Her research interests include behavioral and psychological factors that are associated with long term maintenance of weight loss after medical and surgical treatment for obesity and increasing access to obesity care with the utilization of telemedicine. Today, we're taking on the topic of the body. So let's start here. Even science agrees that most of who we are, what we think, what we do, and how we feel are influenced by mysterious unconscious forces. Today, more people recognize that there's a connection between the mind, body, and a deeper part of us, but few realize that the body itself is a manifestation of the unconscious, and not just in a personal way. Our bodies are also a manifestation of what is in the collective unconscious. Other people, negative energy, dysfunctional, decaying institutions, and ways of thinking impact more than our image of our bodies. These toxins impact our bodies from the skin outside to our organs and our cells. My conversation today with Gretchen Ames will powerfully illustrate the power of a depth psychology framework to first understand that our bodies and our images of our bodies are impacted by forces outside of us that combine with unknown parts of us. And personally, beneath the rubble of old wounds is a treasure that, when acknowledged, releases a reservoir of energy devoted to a renewed sense of self and purpose. So let's get started. All right. Well, welcome, Gretchen, to Dose of Depth podcast.
Thank you for having me. I'm excited to have this conversation.
Oh, I'm super excited. Even doing your intro was exciting. And you and I like, ooh, we start in our sessions, and so this has been percolating, I think, for a while. So, and also, like, I feel like our connection and how our work together has bridged the personal, the professional, the collective, all of it is actually a great reflection of something that Jung said. And you also have pull out some really great Jung quotes. But it's this one that individuation involves the transformation of the analyst as well as the patient, stirring up in his or her personality the layers that correspond to the patient's conflicts and insights. So I know you've talked about like, oh yeah, now you're even more aware, have like a different framework for when things come up in you, but it's the same for me. So I love that quote. And I think it would be great to start for people to sort of understand how we got to where we are. So I think we have an origin story that is interesting that begins with a synchronistic event. So that would be great. And then also, maybe we've been working for together over a year, like maybe what has been surprising. And also, I think it's interesting that different people have different ways their unconscious prefers to get their attention. So, if
Mhm.
you want to share that too. So you just, start wherever you want. But our origin story, I think, is interesting.
Yes, it's so much fun. We just happened to be at the same yoga studio probably for several years
Hmm.
before we even made contact with each other. And our yoga studio offers a number of just fun workshops. It's a very easygoing community where you're willing to try new things and something that came onto my radar was a dream workshop. How can I have been a psychologist for this long and not know anything about dreams?
Yeah, most don't, right? Yeah.
No. And I'll admit, I didn't even know what depth psychology was. Did not know that it was even a thing.
Yeah.
Which is kind of embarrassing to say, but that's where I
But
am.
that's sort of intentional. So now you know what the bigger forces have been trying to hide from you.
Yeah. So we did our dream workshop, I think it was October of 2024,
Mhm.
and just introduced all of us to the idea of depth psychology. And for me, I had always wondered, why do I have dreams? The only dreams I have, I just can't wait to wake up.
Yeah.
And I'm just so excited that that was a dream and it wasn't my real experience. And what I didn't know was that is the way of the unconscious trying to get your attention.
Yeah.
That was like, mine, what? What? Because dreams seem so strange and disconnected and the imagery, and you can't make any sense of it. But it has to be that way, or you won't pay
Yeah.
any attention to it.
It's true. And then if you don't like explore it, it just tortures you and follows you for years.
Yes. Well, and then what I thought, then we decided we did an exploratory chat,
Hmm.
which was awesome. And I had some things I wanted to explore in my personal life, some estrangements and a difficulty with my dad and my brother. And that's the direction I thought it was going to go. And then it meandered, which is another thing that I learned, meandering. Oh, I had never let myself do that before, ever.
Yeah.
And it's still hard. It's still hard to say this is okay, just go in this direction because it feels right to do that.
Yeah.
But then we started doing some work around my relationship with my son, which has dramatically improved. And then also then into the context of work and how I felt like I was just missing out on this whole other world of psychology that I had never been exposed to. And I was thinking about this today. Probably in my introduction to psychology class as an undergraduate, maybe a chapter on Freud and Jung, and they throw
Yeah.
them together.
Yeah.
So
Yeah.
that gets lost.
Isn't that fascinating?
Yes, throw them together. They're very different, and people had a lot of reactions to Freudian theory,
Mhm.
and I think Jung just kind of got thrown into that psychoanalytic
Yeah.
framework with him, and it really was a disservice to all that he had to offer.
Yeah.
So yeah,
Yeah, definitely.
that's and then our sessions are amazing. We have an outline of some topics, and wherever it goes, it goes.
Yeah.
And that has been such a gift and I think a blessing for
Yeah.
me.
Yeah. So, like, what's been surprising? What's the most surprising thing?
Well, the ways in which and you help me understand this, how does the unconscious get your attention and try to break through? Like we said, dreams is one of them. And I started keeping a dream journal, which was extremely helpful. If you don't write it down right away, like when you wake up in the morning, you aren't going to remember
Yeah.
enough of it to be helpful to make sense, to get through the imagery and the symbolism and all of that. And you also need someone to help you look
Yeah.
at your dreams from the outside because what you think it is, it's never that. That's been a huge also aha
I mean,
moment for
yeah,
me.
it's just a general rule of thumb. Like whatever your mind really wants to assign meaning right away that conform. And this is neuroscience, right? So this is
Yeah.
not like fluffy stuff. Like Jungian psychology, his theories were developed using the scientific model, right? Like he felt very strongly. I think he sensed like how this would be resisted, but he did use the scientific model. So it's no different than studying the effects of gravity. We can't see
Yeah.
gravity and we can't see what's in the unconscious, but we can see what the effects are when the unconscious is being stirred up. So, yeah,
Yes, and that is not taught,
right.
right? That part is left out. Let's take a deep dive. I mean, you could have a whole Jung course
Hmm.
in undergraduate and
Yeah.
still only scratch the
Oh my
surface.
gosh, right? Yeah.
Yeah. They
So
don't offer that.
I know I want to teach that. I mean,
Oh,
yeah,
you would be so good. Oh,
and it's fun. Isn't depth psychology fun? Like
it
it's
is
just
fun.
it engages your imagination. So, and active imagination is something that you have learned how to value as well.
Yes, and hold, I know exactly where I hold anxiety in my body.
Mm,
And when I start to hold my breath
mm.
and doing yoga for many years, that becomes obvious that the breath work is so important. But the moment like an emotion or anxiety or whatever comes up, you immediately just hold your breath, and I hold it right in my um, abdomen and stomach, and have to really think about, okay, what is this?
Yeah.
Why am I having this reaction right now? Because the mind, at least my mind, my whole life has told me just ignore the body. Just
Oh,
ignore it.
oh,
Well, and you learn
yeah.
that lesson because um, in high school, athletics were a thing for
Mm,
me, and you just get told, well, push through the pain. You can
yeah.
just ignore and, you know, get to where you're going, and it'll be fine. And it usually isn't.
Yeah.
It isn't
And
fine.
And this is such a great way to dig into the topic of the body because the stomach area, right? The womb, I mean the sacral chakra, where there's a lot happening in there personally and collectively. And we've got sexuality and spirituality and creativity and relationships and emotions are all swirling around in there. So, especially for women, it makes sense that we have a difficulty with that part of the body because also we have been the recipient of projections of the meaning, other patriarchal systems deciding what this means for their purposes.
Right.
So I mean, it's really, it makes sense that, and you do have personal experience with the issue as well. But anyway, so I'm really excited to dig in. I mean, I remember the moment where I was like, yeah, you got to know about Marion Woodman, man. Like, and you're like,
I
who's
didn't.
that?
Who?
I
What?
mean, she's like a famous Jungian analyst, and I mean, it was just so, I loved how excited you were, and you know more about her now than I do. But I loved your response that you were excited, but you were also like angry. And it reminded me of when I read Rian Eisler's book Chalice and the Blade in the 90s, which was about this. There was this assumption that the patriarchal lens was the only lens, right? And I remember one powerful story in that book that when they went back and, like archaeologists, when we find old things, there is no such thing as seeing it objectively. There just is not. But there had been this assumption that that was objective and that was history and that was fact, right? And so there was a very specific example in there of like cave drawings.
Mm.
And on the drawings were people with holding something. And the assumption had been that the things that they were holding were weapons. When they went back and they looked and they're like, no, this is actually wheat. Now think about that. Think about the difference in
Hmm.
looking through the lens and assuming that something is a weapon versus something is food.
Sustenance. Yeah.
Right. Like
Yeah.
you right there, you got the toxic masculine, not masculine, because the masculine is not toxic. The toxic masculine jumping to defensiveness and violence versus like nourishment. So so anger is part of the journey of women circling back to like what does it even mean to be feminine? Because we really don't know what the natural is because the natural has sort of been taken away from us. So anyway, so I love how you gave me all these topics. And the first one I think it would be great to start with to educate people is how you refer to the medicalization of psychology when it comes to the body in this topic
Mhm.
of obesity, which you have expertise in, that is causing harm. So wherever you want to go with that, but it was a term that like I intuitively knew exactly what you meant, but it may be a term that most people haven't heard of before. So yeah, so take it away and give us some education.
Well, I will start with probably the most profound in my work life, the most profound Jungian quote. In therapy, the problem is always the whole person, never the symptom alone.
Mm.
And that was one of the first books you said, if you want to get started with Jung, start with Memories, Dreams, and Reflections. And it had just happened to come in an audiobook. So I could listen to it whenever I wanted to. And it was probably 3 days. It took me to listen to the whole thing because it's just so fascinating and interesting. And it just hit me like a ton of bricks. The medicalization of psychology is just treating the symptom.
Yeah.
You can't even begin to help someone unless you give them a diagnosis.
Which
Otherwise,
means saying there's something wrong.
yes,
Yeah.
yes. And that you then have to pathologize the human experience. Someone might be telling you about grief or an interpersonal issue or something that they came up that they were struggling with. It doesn't necessarily mean depression or anxiety or something that you have to label it.
Yeah.
And then also, the medications that we have for mood management, they are mostly prescribed by primary care physicians.
Oh my gosh.
So then most people I see come in and are on maybe one, maybe two medications for something that has been pathologized, whether or not they meet diagnostic criteria or not.
Yeah.
We kind of sort through that, but you don't, in the medicalization of it, give a diagnosis, and you have to have a diagnosis for billing purposes. And so that label then goes in someone's chart and follows them everywhere,
Yeah.
whether it's appropriate or not.
Oh
And
my.
then to me, that's when I understood that. Oh, that is so disappointing.
Yeah. You know, it does also contribute to, I mean, I mean, capitalism and patriarchy just whoop right there because what it does is turn people into victims
Hmm.
without, I mean, even if they don't want to be a victim, right? Like you just
Yes.
end up being a victim. You're indoctrinated to be a victim.
And to act out those symptoms.
Well, right. And there is, there is a lot of research. I remember, I mean, this doesn't seem related, but I remember when I started getting mammograms, I could never just go get a mammogram. I have dense breast tissue. There wasn't even a word for that back then. And
Hmm.
I always had to come back and do more pictures, then 6 months. Like I could never even go a year. Like, I mean, it was just terrible. And so what happened is I started getting freaked out and worried about getting breast cancer because I
Hmm.
would say, well, why do I have to come back? Well, no reason really, but we want you to come back. I'm like, well, but if there's no reason for me to come back, why do like I kept trying to get them to tell me like, is there something wrong? And there really was nothing wrong, but it was implied that there might be something wrong, right?
Right.
And
Yes.
after that, I do believe that I ended up making myself get Guillain-Barré because partially because I was preoccupied with breast cancer all the time. So thankfully I didn't get breast cancer, but I do think I made myself sick. So after that, I learned that there's research that there's a dark side of prevention. Right? So, oh, get a mammogram every year. Oh, get a colonoscopy. Now we know it's just the business model is just to make money. But like there is a percentage of people who end up getting diseases because of the suggestion that they could
Hmm.
possibly get the disease.
Yeah.
Talk about doing harm to people.
Oh, absolutely. And part of that is also sort of the cover your ass component of it.
Yeah.
For medical malpractice, you have to
Yes.
come back every year so that you don't sue me if you
Right.
end up with breast cancer.
Yeah, it is. I mean, it is a mess. And part of what I think is happening right now with, in the darkness, there is a light, right? So there are a lot of people suffering right now, but I'm one of those people that I don't work for a corporate setting. I don't have good insurance. And I've always been like avoiding doctors anyway, but I listened to my doctor, so I went to all of the checkups and did all of the stuff but I think that people have gotten away from knowing that there is wisdom in their body and their body is well suited to heal itself. Now, sometimes something bad can happen, right? But
Sure.
the other
Yeah.
thing that the system, especially when I think it was in the late 70s when the government decided that healthcare could be for profit, right? So that meant that the goal was profit, not health. So I think what has also happened to people is they've been disempowered from connection with the wisdom in their body as well. And I think part of the light side for privileged people anyway is that you really can detach for the most part from the medical system. And there is plenty of knowledge about how to use herbs and how to eat healthy and how to exercise and all of that stuff. But it really takes like deciding not to be a victim. And there's fear because now the healthcare system has got everybody afraid. So to like detach, so it's almost like it's going to get way too expensive and people are just going to be like, well, I can't even afford insurance. So now what? I mean, it might like
Yeah.
be that we're boomeranging back, but being forced to really come back into relationship with our own source of wisdom. So I don't know.
Well, and like me, people don't pay attention to their bodies until they maybe really do need
Yeah.
medical care.
Yeah.
And we don't do a lot of the prevention things. We've really just engineered that out of our lives, like
Yeah.
eating well.
Right. You're
Yes.
right. Somebody asked me, I went to a funeral yesterday and somebody said, you don't age. Like, what? Do you exercise? I'm like, well, yes, that's kind of a basic one. I said, I just kind of follow the rules. And also, I do believe I'm 27 inside. And I think, like, I don't know, sometimes people believe I don't know, only 40. So I'll take it. Right. So, but,
Yes.
um, but yeah, it's like, yeah, yes, there are things that you need to do. But I think here's where a depth psychology perspective really can, and I think this is where depth psychology ends up being also spiritual. So spiritual, not meaning religious, but spiritual meaning connection to yourself, which is the bridge to what's around you. So if some people feel connected to nature, or to the quantum realm or to the Christian God, or it doesn't really matter. But when you realize that you are worthy because you breathe, that you did not create yourself. Maybe it's just consciousness, right? That's how I look at it. It's just consciousness created me to see what consciousness was capable of, to be a mirror. That automatically is like, whoa, I'm important.
Hmm.
Right. And so part of the medicalization model is to cause people to be in fear and to feel insecure and to feel afraid and to feel a sense of unworthiness. And depth psychology is the journey back to a sense of self with the capital S self.
Well, and if I do what I'm told in this healthcare system, then bad things won't happen to me. And
Right.
they do.
Yeah. I mean, it's so sinister, isn't it?
Yes, but that
Yeah.
you're right. It is a lot of the just even the mammogram every year. But you know what's interesting? Maybe AI can help us in this way where it can sort through and say, you know what, 80% of breast biopsies end up being negative.
Oh, is
Is
it that
there,
high?
yeah,
Oh, I didn't even realize.
it's
I've
that
had two.
high.
They were
Yes.
negative. Yeah.
And think about how much anxiety, say you can't get
Yeah.
scheduled for 3 weeks and your mind is just running away with the possibilities of, oh, I probably have breast cancer. And
Oh
then,
my God. It's
or
true. I remember like she took it out. It's a funny story actually. She's like, "Do you want to see it?" And I'm like, "Sure, why not?" And I almost passed out looking at whatever it was that they took out. But anyway, I'm like, "Well, when do I find out?" She's like, "Don't stress." I want to punch her in the face.
yes,
I want,
you
what do
can't
you
get
mean?
rid of a thought with a
Well,
thought, right?
right. What do you mean don't stress? So yeah, oh yeah, I'm sure a lot of people are relating to this. So okay, I mentioned Chalice and the Blade and how that like woof, it made me angry and then it empowered me. And then during my research was on which was women's experience of reconciling sexuality and spirituality. That's very tied to the body. Rianne Eisler's book, Sacred Pleasure. Oh my gosh, I learned so much about that. And then The Sacred Prostitute, because she talks about how pleasure went from being sacralized, celebrated, to pain and suffering being sacralized. And the Christian religion is very good at like sacralizing or, having reverence for suffering. And so moving on to that, then when I found the sacred prostitute, Jungian analyst, Nancy Qualls Corbett, I was like, oh my gosh, I knew it. Like women know in their bodies that they are right and the world around them is wrong, that they are to be revered, that the body is to be revered, that pleasure is good, that sexual union is good when it's an empowered sort of sexual union. And that sexuality with the feminine, through the feminine, is the bridge to the divine. I mean, that's empowering. So you just had one little bullet point, and your topic was the body as a cultural symbol. And so I'd love for you to share like your thoughts on that.
Well, I started to take a deep dive into history I kind of knew this, but looked at it more in depth. Really prior to 1800s, the body was a symbol of abundance,
Yeah.
blessing, privilege. It was to be revered and that was a symbol of you have plenty in your life. And then a number of different forces came around to have it like within 100 years of complete and total inversion
Yeah.
of that process. And in my research brought up was the Age of Enlightenment, where self-discipline started to come into the
Mm.
narrative, and they call it male rationality.
Yeah.
I,
The
I don't want
reason,
to.
well, the masculine is the reason, but it has nothing to do with male, being a
Right,
male. Yeah.
right. Yes, then that can be a little loaded, but
Yes.
you get what I mean.
Yep.
And then bring in colonialism. And I didn't know, I found this
Mm.
so interesting. Colonialism was when the sugar trade took off.
Oh,
So sugar was moving all around the globe, mostly to Europe and to white people in Europe, really. And physicians started to notice that when there's sugar, are gaining weight, their bodies are getting heavier, larger size. They also associated it with tooth decay.
mm.
So that was sort of the first inkling of, okay, maybe this is a medical issue, and that has stuck with us. It's good and bad in some ways.
Yeah.
And then I came across another woman's writing, Sabrina Strings. I had never heard of her, and her book, Fearing the Black Body: The Racial Origins of Fat Phobia. And she
Ooh.
wrote that in 2019. And it's really, really fascinating how then racial hierarchy came into judgment about body size, body shape, features, all of that. And somehow, in the midst of this, being white and being thin and having certain facial structures sort of rose to the top of the hierarchy, which is where it still remains too. And she makes an argument too, where Black women, the idea of being thin was never meant for them. They don't buy
Right.
into it at
Right.
all.
Right.
And that's exactly how it should be. But it's when I started to read and think about that, it's this whole history of deciding whose body isn't the right size.
My gosh. You know what's
Yeah.
so, you know what's interesting? That reminds me of when I was seeing a hormone doctor. Now this was probably 10 years ago. I got plunged into perimenopause because of stress, really. It was my
Yeah.
situation with my husband. It was complicated, but the hormone doctor said that there was research that the most like stressed out people were white women, suburban women in their 50s. Not that they all had a reason to be stressed out, though. Here's what I want to say is like,
Yes.
because I'm privileged. Like these women are privileged, and yet they have this most anxiety of any other group. And it's interesting because yes, because and this has got to be this is part of patriarchy, this is part of capitalism, is that I think like I don't know, I want to do a good job at everything. Right? So it's like, tell me what to do. Oh yes, I need to be this kind of parent. Okay, I'm there. I need to do this. I mean, that is weakness,
Yeah.
right? That really is like a sense of insecurity to feel like I need to be doing this, modern version of parenting. And, and because I wanted to like get away from the way that my parents did it, I mean, I'm not unhappy with the way that I parented. I think the point is like this preoccupation for perfection,
Hmm.
really. And I think like good for Black women to be like, fuck
Yes.
that, man. No,
I'm
I
not
love my
subscribing to
body.
that.
By
It's
the way,
not
I
for
love,
me.
by the way, I love their bodies too. Like I'm
I
watching a
know.
really, I mean, I just beautiful. Dark skin is beautiful. But,
Yes.
um, but that's fascinating. So, okay.
Well, and how could you not have anxiety if you are absorbing everything the world is projecting onto your
Right.
body,
Yes.
and the way you look and aging, weight gain, whatever it is? If you are very much caught up into what's being projected onto your body, I don't know how you ever feel good.
Yeah. Yeah. I mentioned that in the intro that, and I referred to James Hillman, of course, because he really criticizes psychology and therapy as personalizing it. Even think about it, even when the real diagnosis of anxiety has today has to do with the systems that we live in. So that should be the
Mhm.
diagnosis.
Right. The
Right?
system
Not
doesn't fit.
right, not like there's anything wrong with you. Like if you're not anxious today, there's something wrong with you. Right? Like then you're just or you're like high all the time, right? If you're able to
Yeah.
just be like la 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 la. So, yeah, so it's people are what the therapy has done is made people carry the burden personally for what really is a collective issue.
Hmm.
Right. And so, and then underneath that are some personal things, right? So the wounds, we all have the wounds from childhood and whatever, that connects with whatever particular thing is being projected onto. So one of those will just go zip and find your wound. And so part of the process of freeing yourself from the toxins around you, which are just exaggerating whatever the personal aspect is tiny compared to the collective aspect. So the journey is to go inward and to explore the roots of your particular relationship with the body and food and all of that. And then you totally can see things. And then suddenly you're like, oh, I actually don't care what they think.
Yeah.
Right. But now this is where the medical model then is very sinister because they don't want that problem solved.
No,
They
and
really
they have
don't.
very narrow and going along the trajectory of history, very narrow definitions of what health is. When we started, it actually started with the um, insurance metropolitan life tables, where you would point to one
Mm.
height and you should
Oh,
be that weight
yeah.
for every person's body. But that's when life insurance was getting started.
Yeah.
So it
Mm.
was just data about, okay, this group of people is probably going to live the longest, so your body size should be that. And then BMI, body mass index, is used in all the wrong ways now. It was
Mm.
only ever meant to study populations and how
Mm.
maybe population level body mass index is going up over time. And you can see that between the 60s and where we are now. But it was never meant to make a diagnosis of obesity.
Oh my
It
gosh.
was never meant to direct treatment. What happened there is that insurance companies latched on to putting people into categories
Yeah.
and then deny them care. Well, you
Oh,
don't quite meet the qualification to get help. So we're
oh
going
my
to tell you
God.
no.
Oh my
So call
God.
us back when you've gained more weight and are
So
sicker, and then we'll help
so
you.
let's make you think you're sick. Let's make you dependent on us and then but let's not help you. Unless we can sell you an expensive surgery.
Yes, yes. And or if you take pharmaceuticals, you are tying yourself to a doctor every 3 months. You have
Ugh.
to get follow-ups for all of those things. Body mass index was also never meant to assess how well you have done with treatment or losing weight or trying to improve your health status. But
Yeah.
physicians will just say, "Oh, well, here's what the normal range is." And
Oh,
that's what you're supposed to be. And it's just unhelpful, and people really tie their self-worth to a number on the scale or a body mass index number.
instead of
Um,
like what feels good for their
if you're
body.
healthy,
Yeah.
you're healthy. And so it
Right.
doesn't matter what
So,
your weight
right.
is
Yeah, exactly.
or your BMI.
Right.
But people have, because they've been told this their whole lives. I have that conversation so many times a day and multiple times with every patient. Not sure they still even believe it, but
Yeah.
we talk about that every visit. The number doesn't
Wow.
matter.
Wow.
Who cares
Oh my
what the
God.
number on the scale is? That if you are clear on your health goals, what health outcomes do you want?
Yes.
When those are achieved, you're just right.
Yeah.
And people, nobody believes me. Well, my doctors, no, no,
Start a
no, no.
trend, man. Start a trend. Get out there. Get detached from those people.
Those numbers, yes. And then so medicine is all mixed in there.
Okay.
Um, Also, we've kind of touched on this. Religion talks about the seven deadly sins, gluttony and sloth, and if you don't meet a certain aesthetic, then there's something wrong with you. The diet industry, I call it the diet industrial complex, that started in the 60s.
Mm-hmm.
And the message was if you're not thin, then you're unhealthy, which isn't true.
Right.
And if you're not thin, there's something wrong with you. So you should always be trying to be thin.
Oh my God.
Always, always dieting. And that's really true. Most women,
And now we know that's even bad for you.
most women I meet have tried at least 7 diets,
Oh my
at
gosh.
least.
Wow.
And it's been just for their self-confidence and how they feel about their bodies. It's been extremely destructive.
Yeah.
Extremely. But again, most people I see too are coming in for health.
Yeah.
Like, I don't want to have diabetes.
Right.
Now I have to wear a CPAP machine, which I hate.
Oh,
I have hypertension. I'm worried about a stroke or kidney
yeah.
disease. So those are real reasons to
Yes.
want to lose weight.
Yeah.
But it doesn't mean you have to be either the normal or ideal body either.
Yeah.
Wherever you're healthy
Yeah.
is the goal.
Yeah.
And there's
Uh,
not one right way to lose weight. That's another thing. People get blamed and shamed for making a choice for their health.
oh my gosh.
Oh, you had surgery. You cheated. You took the easy way out. And people are getting a lot of
Oh,
backlash with these newer medicines too.
oh my gosh. It doesn't matter what you do, right? Like everybody's got an opinion about it. Yeah, I think I told you about my daughter who's a therapist and also she has PCOS.
Yeah.
And so she ended up and I have my own thoughts about like what is the cause of PCOS. I believe it's probably being poisoned by corporations in our food. And it alters our
Mhm.
hormones and so that's not her fault, right? But and but she was in one of her meetings with the other therapists and I mean it was fascinating. They were basically shaming their clients who were overweight, shaming them for wanting to lose weight. And these weren't clients who were hateful
Yes.
of their bodies, right? So it's so nuanced, right? You can't just put people in a box. So there are bigger women like, my daughter who has a medical issue. She's she is very confident about her looks and her, right? So, but
Yeah.
she wants to be healthier, right? And so then to have a therapist say, "Oh, you don't love," that means you don't love your body. So like you're shamed for being overweight, and but now there's this new movement, "Oh,
Hmm.
love your body the way it is."
Hmm.
So then if you want to actually change your body for health reasons and be, now you don't love your body? Like what? It's so confusing. It's like
It
no matter
is.
what, you're
Yes.
just wrong.
Yes. Well, it's so there's a couple of those movements. There's positivity,
Hmm.
intuitive eating, health at every size
Hmm.
movement. And if you think about this, where we've come around perceptions of body, first, loving it. It was great. Abundance, wealth, privilege.
Yeah.
Then the pendulum swings the other way. That well, kind of disowning the culture disowns everything that we don't like, right? Lack of self-discipline, perceived weakness, willpower, morality issues. That's what's been projected onto to people's bodies. So these newer movements pushing back on that, but then they're doing the same thing.
As soon
They're
as it, yeah, as soon as like a beautiful concept, like, oh, let me linger in that. Yes, I love myself and I think I need to do some things to increase my health, right? But
Yes.
this is late stage capitalism also. So it's like as soon as there's a beautiful new insight, it is captured and commoditized and it turns into a black or white thing, and either or. Right? So that means, so if you want to lose weight and you're big, even your desire to change your body means you don't love your body. That's not true. But there's this
Right.
like late stage capitalism. First of all, it's accelerating. So everybody's trying to like make a quick buck, basically, is what happens. And then these terms they become generic and they become meaningless, actually. So even those movements now can do damage. And at a certain point, they might do more damage than, than help.
Well, and some of them have gone so far as to say trying to lose weight can cause eating disorders, or cause, if you're trying to lose weight, you're causing harm in other ways, which in and of itself is harmful.
Right.
Just don't do that.
Oh, man. Well, we certainly are
Yeah.
going through something where there's such a reductionism happening that at a certain point there will be, I don't know if it'll be it can't be just a swing. It's got to be a reconciliation of things. So it's got to be Jung's transcendent third, right? Where like you as an individual are going to have to sit with some things and figure out how to reconcile what appears to be opposing. Because that's the problem, is the lack of self-reflection about what really is
Mhm.
going on inside me that I need to deal with, instead of allowing people to tell me what to think and what to do about it.
So the idea would be the individual work then leads to a new collective.
Well, yes. So, I'm driven by Jung's suggestion that the fate of humanity depends upon the self-reflecting individual who can resist mass-minded ideas. So this is, I often refer to what's happening now as the age of the individual, not from a narcissist standpoint, but from a self-knowledge standpoint. Because I think most people are walking away not realizing that are they literally are 5% free. Think about that. Like they're so automated that they literally aren't their own person. They're defined and controlled and indoctrinated. And yeah, so think about the power and the pressure of everything that's happening. Everything's doubling down. But out of that pressure, the challenge is that people don't have a framework for even how to think about it, right? Like I was even having a conversation with a mom and a daughter, and we were talking about magnesium, because this woman, older woman, has restless leg syndrome,
Mm.
and she takes a medication. I'm like, do you take magnesium? I said, apparently everybody needs magnesium after 50 now. And she's like, no, what's that? And I'm like, oh, your doctor didn't even like say you
Oh
could take
no.
magnesium instead of a. So I helped her. I'm like, obviously, I don't know. You need to check with your doctor. I don't know if this could be bad for you, but like magnesium. And her daughter's a nurse, and her daughter's like, yeah, don't you know about magnesium? So, but anyway,
Yeah.
then we were talking about swallowing pills. And the daughter says, I can't swallow any pills because when I was a child, my mother shook me and she said, swallow this pill, because, and I was like, oh my gosh, yeah, that's trauma. Like, holy crap,
Yes.
you were like shaken baby syndrome and you were like 6 years old. And then the mom is like, well, she had a 104-degree temperature. And I was like so scared. And I was like, oh, yeah, I get that. But they couldn't even understand. Like the daughter was like, that's why. I said, oh, so you're still like blaming your mother for this issue? Yes. And I said to the mother, I said, oh, do you see how you traumatized your daughter? And she couldn't
Mm.
acknowledge that because she was defensive.
Hmm.
Now, in our work, this is a very typical complex and parental complexes and projection conversation, right? But
Yeah.
they could not separate any of that. And both of these people have a weight issue. And the mother said, can you help me figure out why I can't stop eating? And I'm like, yes, I can. Yes, I
Mm-hmm.
can. So
Mm-hmm.
people are like, this is the problem when we don't really, and this is by design, and our systems don't want people to have self-knowledge, right? Because
Yeah.
then they will decide, what am I doing? What? I don't need that. I don't gotta buy that anymore, right? Like at all, the diet industry relies on
Oh, it's a
the
billion
fitness
dollars.
industry and the medical. They're all like not purposely
Yeah.
colluding, but they're colluding in a way because the system allows for the collusion. So
Yes.
it's
Well,
very, yeah,
your trick of it's not a trick, it's a strategy. Um, I've used this a number of times now. What is your earliest memory
yeah,
about food as emotional comfort? And
yeah,
there's always a hole there. There's
yes,
always something that was missing, or it's associated with the time the person was really made aware of their size and they were different and they
yep,
needed to be put on a diet.
yeah,
And usually, or and the mother is dieting, or they're getting that message in the house.
yeah,
You're gaining weight. That's a
yeah.
problem. Now it's a problem to be solved.
Yeah, and some people will even know like what the root is, but often it just becomes an enabler. It becomes an excuse, like for this younger woman who's like, well, yeah, I just can't take pills and it's her fault. And like, right? So even that has probably led to a pattern of avoiding more than just taking pills, right? That little traumatic event.
Hmm.
So many times people might be aware, but in Jungian psychology, we don't just ask why. We ask, oh, okay, why? But why now are we exploring this for? And then what does it have to do with us moving forward? And we want to release and accept this old part and integrate it. And then out of that comes the treasure of our gift. So, that,
Well, with weight and body, it's going to be tricky because the movements are always fighting each other.
yeah.
It's just the back and forth that,
Right.
um,
So the answer is like to detach from the noise out there and to go inward and to be like, this can't intuitively, any of this make sense? Right. So people have given up the relationship with their inner wisdom because they are never told that they have any inner wisdom. Right.
right.
So,
Yeah. But I can love my body and want to be healthy. Those two things can
Yeah.
exist. And if weight loss is a part of that, then that's okay.
Yeah.
And one thing that drives me crazy is legitimate weight loss is hard work.
Yeah.
If you,
Well, that's why somebody asked me yesterday at the funeral, like, do you exercise? I'm like, Yes. Yes, but yes, I do. But that can look different for everybody too.
yes, and
You don't have to even
sometimes
make it a thing. You could just go
no.
walk every day. Yeah.
Well, and embracing, we have all these other amazing tools. And if you need them, if you've tried everything there is to try, and or for your restless legs, you get put on a medication that makes you gain 30 pounds because that's what they usually do.
Right.
And people have no idea. Oh
Yeah.
my gosh, I didn't know
Oh,
that I'm on three different weight gaining medicines.
yeah. So like your
And
last point in this section is, then it's easier to blame the individual, right? Rather than
yes,
the system is broken. The system is causing suffering and the system is then projecting you're the problem. It's really sad.
it
Very
is.
heartbreaking, actually.
And I guess the my part of the transcendent third is just individual by individual
Yeah.
and helping people. If you do choose to um, seek help to lose weight and gain health, how can you be okay with that?
Yeah. I think ooh, you just hit on something. I think for every individual person, the things that are at odds are different. So the clue would be to figure out what's at odds. It's a conflict of beliefs in their belief system. So it could be if I'm not this, if I'm this, I'm not this, or I can't be this. So that's what it always is about is thinking that there are two things that are mutually exclusive and holding then the tension between them to find what reconciles them. And then when the reconciliation happens, there is release and there's physical release, there's weight release, actually. So then it's not as much about doing as it starts from the inside, this sort of release psychologically.
And that piece is missing too. We will probably get to this later, but what happens when people do lose weight and it wasn't what they thought that it would be? They're still struggling.
Well, right. So this is a good place to bring this up. So you've talked about some of your patients who they have very good results and they go out into the world getting positive feedback but mistakenly believing that it is that they change their body that they're getting their feedback, but it's not. They've changed their belief about themselves, but they think it's because of the weight. And so the last part of it would be to understand that when you lost this weight, you immediately felt better about yourself. Isn't that crazy? You're the same person, your body looks different,
Yes.
but you felt better. Now, we emit a frequency. Okay. Isn't it lovely to be around people who have confidence? You feel that, right? So now you have more confidence. Well, of course, the world is going to reorganize to match your new sense of confidence. You are mistakenly believing it's your weight loss. That's not what it is. So your job now is to say, okay, but it helped to lose the weight. Yes, absolutely. Sometimes the external will help with the inner, but the inner is your grounding. So then you
Mhm.
must go on to learn how to detach your sense of confidence from the actual weight loss, which, by the way, will keep the weight loss. In the end, that's what will do it. Not the doing and the punishing yourself if you have a rip your float or whatever it is. It is the inner sense of self that is the cause of the good looking guy showing up now. Because we know big, beautiful, bold women who don't have any problem getting a date. Why is
Right.
that? So we know it's not about the body, the size of their body. It is about what are they emanating? What's their essence?
And it is interesting you say that a certain number of my patients are actually quite angry about how people treat them after large weight loss. And they will say, I'm still me. I am this same person I've always been. What was wrong with me before? The
Well, but okay, but they're not. I mean, that's interesting. So I would want to get to the bottom of the anger because the anger still means that you're using the external world to validate you. So who cares if some people are, who cares? Like, why do you care? Why do you care about that? Let's go there, man. There you go. That's the unconscious speaking. It shouldn't care. You wanted this. Now you're mad that you're getting what you wanted.
I haven't gone there yet.
Well,
That's why I need
you
you for
know me.
supervision.
You know me. I just get right. I just cut right to it. I'm like, oh, that's very victimish.
I know.
Okay, so
Uh,
Marion Woodman,
yes.
who you are now more of I'm not an expert. You're not an expert, but you know a lot more about her than I do now. And I was very, I guess what I would love for you to, I don't know, share is just how she seduced you and what she did for you, like what insights you got, and you're like, oh my gosh, this is amazing. And then I love that you want to critique her because this caused me to remember that what was different about Jung than Freud, Freud was all about himself and his legacy and all this stuff. What was different about Jung is he is like, he would hate the idea in fact, he said this in an interview. He's like, there is no such thing as Jungian. I'm young. I'm the only Jungian. My psychological theories
Yeah.
are born out of my psychology as a lens for studying psychology, right? So
Right.
he would hate that there is such a thing as a Jungian school of thought or Jungian psychology. Um, so anyway, so I had a whole class about critiquing Jung because because there are people who bring up certain things about him because he as much as he valued the feminine, and depth psychology really is the psychology of the feminine, the psychology of the what's been pushed in the unconscious, the feminine nature. He was still lived in misogynistic times. So
Yes.
he brought that sense, but he wasn't perfect, right? So to be able to critique and expand, and his theory on the anima and animus have been expanded by women Jungian analysts. And it's really interesting to see because I was like, that's not true for me. Like, no, I needed to come into relationship first with my anima, but you're saying that's in men, only in men. Like, anyway, so I'm
Mm-hmm.
really like, so share, so educate my peeps on Marion Woodman and all your thoughts about her.
Well, I think I'll just say one thing about Jung first. I think some of the funnest parts of his writing are he's very self-deprecating
Yeah.
and he will say, I don't have this right, or he was very, very open to being critiqued,
Hmm.
I think, which is um, not always true of
Refreshing,
scholars.
right? Yeah.
Yes, yes. Well, so Marion Woodman, a different time, I just looked this up. She was born in 1928 and died in 2018. So she lived to be almost 90. And it's a different time from Freud and different time for women. But she didn't really even do her best work until she was in her 50s.
Mhm.
She was an English teacher for 20 years, which I'm sure is how she developed her beautiful writing. Sometimes it is dense and deep, but it's still interesting and very well written. She then went to the Jungian Institute in Zurich, I believe, at later in life and got a PhD. And her two important works came out in the early 80s around this idea that obesity and eating disorders are really a symptom of the same thing, which is the repressed feminine. And she obviously in the 60s, 70s, 80s, feminism was
Yeah.
rising and more of a topic. But she was saying the feminine intuition, receptivity, embodiment, feeling, when all those are suppressed for women, it's going to come out in the body, whether it's in an eating disorder or it's obesity. And she wrote about that first and then sort of took it outward more to just addiction to perfection. She actually has a book that's titled Addiction to Perfection, The Still Unravished Bride
Yeah.
from 1982. That one's an audiobook, so people can listen to that one. It's excellent. But the critique of her later on, um, Jungians and another woman who wrote about all of this from the perspective as a woman living in a larger body
Mhm.
then took on, okay, well, Marion Woodman had an eating disorder and was a thinner white woman.
Yeah.
Here's some things she's missing
Yeah.
from a woman living in a larger body. And that's Cheryl Fuller. And her title is The Fat Lady Sings, a psychological exploration of cultural fat complex and its effects. So
Ooh.
that one's very good too. And it came out
Yeah.
in 2017. So there's kind of all this push pull around the idea of is the body a symptom of something, and are we on the right track here?
Yeah. Mm.
So
Interesting. I
yeah,
just, what's coming up for me is also like the toxic masculine and patriarchy because this like just I don't know this uh well, the feminine is meandering, right? And relationship oriented and connection and pattern. And the masculine is linear and things sort of make sense and forward moving, achievement oriented goals. But the toxic masculine is that on steroids, right? And then we have like, we have toxic feminine too, right? So there's the dark side of the feminine. There's the dark side of love, right? A vampire, a mother who becomes a vampire of her children and sucks their energy. So it really is quite a mess. But I think the masculine is somehow in there too. Like it's like we're using the body as like a commodity instead of like an extension of our soul. Because if, some spiritual teachers will say, we are a spirit or we're a spiritual being having a human experience, and the vessel that we're mostly constrained by is the human body. So I don't know. Oh, yeah. Now my
it's a lifetime of work,
I mean it is. I mean
really.
if you just sit in that, your body is a manifestation of your unconscious. Just think about it that way. So
Yeah.
if there is something about your body that is bothering you, the root is inside. No matter what, the root is just inside. So that is where the work has to be done. And then you can do it in partnership with things outside too. Like there are things you can take actions. But if the actions aren't coming from that source of wisdom, they're the wrong actions. So often I will tell people if you're like, well, what should I do for exercise? Should I do yoga? Should I walk or should I go to the gym? Put your hand on your heart center and see which one feels exhausting and which one feels peaceful. There's your answer. You don't even need another person to tell you which workout regime you should do. Because if you're not going into it with a sense of peace and contentment, it's not actually going to help you solve your problem. So, I love
Well, and
this.
sometimes you need to meander into it. Just move.
Yes, you
Just
do.
get up and move
This is
and
really, I actually don't
see.
have any clients who are working with me because of their body. Ooh, I mean, I don't know. I'm ready out there. I want to explore this some more.
Well, and
Okay.
that's how I didn't even know this was what it would become, but we spend a fair amount of our time together in supervision for me so I can be better
Yeah. Yeah.
because you have this just well of knowledge and things, ways that I've never thought about things, that my connection with my patients is so much richer because I have now this new, not nearly what you have, but I'm working on it. I'm reading and trying to
Well,
educate myself.
well, I mean, just the notion that uh 80% of what's going on is in your unconscious. Right there, that just changes the conversation, right? And then we have all these different ways that the unconscious speaks to him. So it's a conflict. Yeah, I just had a fight with whoever. Let's start there. If you don't think that's related to your body issue, you're crazy. It's all your unconscious is just speaking to you. So, yes,
Yeah.
I'm glad that you brought that up because one of the really gratifying parts of our working together is that you have found a new sense of inspiration in your work because you were feeling like a victim because you have to work within the
The
system. Yeah.
medicalization of what I do and diagnosis and
Right.
all
And
of
then
it.
and then suddenly you're turned on to this depth psychology perspective and
Mhm.
it has like you're excited about you're still in the same situation. It hasn't changed. And yet you're like having different kinds of experiences with
Mhm.
people, connecting with people, and you're being
Yes.
transformed too.
Well, and I didn't even know I needed it. I've been doing this for 20 years. Thinking, yeah,
Oh, yeah, because you came to me about your relationship with your son. And then all of a sudden we're talking about Marion Woodman. And that's what you mean by meandering into it. So that is the
yes.
unconscious. So that is synchronicity. Like you came to my dream workshop. And then that led to that and led to that. And your self inside has been guiding you all this way. It's crazy.
It's, I never would have imagined it. Not in a million years. But kind of bringing it full circle, I don't, it's hard for someone like me. I don't necessarily have a diagnosis. How do you even get help?
Yeah,
How do you,
well,
in the
that
system we're in, how do
I
you get
know.
help?
Well, I think what's interesting is I know that there are a lot of I know Carl Jung, he's here, man. He's showing up everywhere in somatic therapy. That's all I mean, not all Carl Jung. That's all depth psychology.
Yeah.
Somatic therapy is just a branch, like all these are just different eco psychologies, all comes out of going inside and recognizing connection versus looking at things outside of you, basically. So, um, there are now sent even like therapy clinics that offer, conventional therapy that goes through insurance, but they also offer other programs that insurance just isn't going to cover because it doesn't fit into their model, but they're still
Mhm.
offering it. Right.
That's
So,
progress. Yeah.
yes. So, and I will have therapists send me people who want to explore dreams, for example. And they might just do a couple of sessions with me because the therapist is not trained to do dreams. And she was my client too. So the therapist was my client. And then she would send me clients who, she's like, here, I got somebody, or somebody, I think she may send me somebody who has some sexual trauma. And I mean, approaching that from a depth psychology lens is very different than conventional therapy as well. So,
And I'm not
so
sure conventional therapy is all that effective. If you leave the body out,
right. If you leave
where are
the
you going to
body,
get?
well, here's the thing. It avoids the body, sexuality, and spirituality, and that's everything. That's everything.
That is that is so true.
And it is
Yeah.
everything. Like, how can you leave those things out? So, okay, so we touched on that. I think the last thing that you mentioned here is impacts of weight loss. I mean, I think we maybe just a tiny bit. What happens with symptom removal without deeper meaning? So we kind of talked a little bit about it. And then underlying complex displaces somewhere else in the shadow. And then you have you talk about body dysmorphia persists. So like what did
Yeah.
we get to?
Well, sometimes after large weight loss, um, oh, and we can maybe touch on the GLP-1 medications too,
Okay.
since that is everywhere.
Yeah.
But sometimes after a large weight loss, people will say to me, I look in the mirror and I still see my larger body. I
Hmm.
don't see it. And sometimes that resolves, but then also bring in the issue of having loose skin
Oh, yeah.
and the body doesn't. Sometimes people will get to a weight they haven't been in 20, 25
Yeah.
years, and it's not the body they remember.
Yeah.
And they have a hard time with, oh, I didn't know this is what I would
Yeah.
look like. I'm
Yeah.
healthier, but I'm not so
Yeah.
happy with my body.
Yeah.
So that kind of work, and sometimes people still have kind of depression, anxiety, um, if they have had sexual trauma, and now there's increased attention
Oh, yeah.
to
Oh,
their physical body,
yeah.
that can cause a lot of reaction to.
Yeah. I mean, those are all issues that are very perfect for a depth psychology perspective because it's
Mhm.
digging into the symbolism. Like even like looking in the mirror and still seeing a body that's different from what
I
it
hear that
is.
like once a week. Once a
Wow.
week, someone will say that
So
to
then
me,
they
and then
have they have
can I
not
hit pause? I gotta ask Deborah.
well, yes. Well, they have not released something. So you could explore like well, first you could do active imagination. You know enough about it and you've done it enough that you could do it. So you could slip back into that image of them standing in front of the mirror and ask them to describe like what is the image. So there, and then you could also bring it back to their body. You could also start with the emotion, like what is the emotion? What is the emotion she's even feeling as she looks at that? Is it disappointment? Is it anger? Is it like whatever it is? And you could go to that question, what's your earliest memory of feeling that? Whatever what it could be any of those emotions, right? Whatever that is. You could locate it in the body. You could tie it back to the just see where the imagination takes her and see if an image comes up. Because if
Yeah.
she's seeing something that she is the one who hasn't released it. And also, I bet there's some neuroscience in there too, because I'm thinking about people who lose a limb, but they still sense.
I had
So
not
there,
thought of it that
there
way.
could be that part of
Like
it that,
phantom limb.
yeah, that there's still some, especially if it's a lot that she's lost. I mean, think about that is a loss. So she may still be hanging on to something symbolically that needs to be released. And that's grief. You are like losing,
Mhm.
even though we're not really solid. That's the other thing is that people are mistaken. They think we're solid and we're not. We're just waves that are localized. And so there's a subtle body energy. I think it would be interesting to ask her in active imagination, okay, let's look at this. You're seeing something that isn't in alignment with what you think is concrete. And like, what is the shape? And does it have a color? And does it have a subtle
Mhm.
energy to it? And oh my gosh, that's potentially a really rich exploration for this person.
I'm so glad we had this conversation because it comes up once a week.
Oh
I
my
have to
goodness.
go there. I
Well,
have
let's
to.
let's talk about it more in our next session. Yeah, I love that. And the thing about the skin, that's real, man. I mean, right before, like I was a weight for a long time, and then in my stubbornness to not allow the truth of my situation, I gained an extra 15 pounds and I was eating perfectly. I think I was drinking more though, but I was eating perfectly. I was working out more. It was like the more that I did, the more weight I gained, right? Because why? Because you're not allowing something to reach your consciousness. And then, and then when I recognize, oh man, this is where I am. This is the relationship. Everything fell apart. Oh my God. As soon as I started going to see somebody to talk about it, I literally like lost all the 15 pounds. And then I lost 10 more. The extra 10 left me the skin in my belly.
Hmm.
It's not a
Yeah.
lot, not like now there's a drug for that too, or there's a procedure for it. And I don't know if it's a healthy procedure or not. But yeah, I was like, oh, yeah, I want it to be 125 again, but I don't know. Like, this is not very, it's kind of loose, saggy skin. It's not fun. So it's for somebody who's lost like 50 pounds and then all of a sudden they have the skin.
Try 150.
Then
I
they should be, if there is a healthy way to get rid of that, they shouldn't feel bad about going and having that
No,
procedure.
I have
Yeah.
that discussion too. At the 12
Yeah.
month mark, if you are interested in, it's usually in plastic surgery and skin removal, absolutely.
Yeah. Yeah.
Yes, do that. Especially sometimes it will cause rashes, irritation, functional problems. It
Mhm.
gets in the way. I the problem is insurance companies treat it as cosmetic.
Yeah.
So then it's quite expensive and out of reach.
I think it should
Or
be, well, this is my opinion, but that's not cosmetic. That is like mental health. That should go along with that
it's a
should be
package.
anticipated. Yeah, I think
Oh
so.
no.
Yeah. Mm.
They sometimes they will pay, like if you can make a medical case that the abdomen skin, you're having to treat it all the time and it's
Yeah.
causing problems, they will, but nothing
Also,
else.
also acupuncture might be good for that. But anyway, so what do you want to say about
Yes.
the GL, what is it called? GLP drug?
Oh, so these new medicines, people would know them as Wegovy, Zepbound. That's the weight loss version. The diabetes version of the drugs are Mounjaro and Ozempic. So the drug companies have split up weight loss and diabetes. Talk about something that makes absolutely no sense and is harming people,
Oh my
right? We'll
God.
pay for you to treat your diabetes,
Oh my
but we
gosh.
won't give you the weight loss drug until you get diabetes. And then
Oh
you can
my,
have the diabetes drug.
oh my gosh.
It's horrible. But anyway, these new medicines are the biggest breakthrough in obesity medications ever,
Wow.
ever. My fear is that if the idea is for these medicines just to become like statins, like blood pressure medicines, they're in the water pretty much,
Wow.
then we are letting the broken systems off the hook,
Yeah.
right?
Yeah.
And nobody has to care about the food environment or
Oh.
that people don't have safe places to exercise. There are food deserts everywhere. Um,
Oh.
Nothing, if we can treat this problem with medication, then nothing has to change. And really who wins is pharmaceutical
Yeah.
companies.
Oof.
Yeah, that's a tough one. And there's more and more, there's a couple of medicines out now, both Lilly and Novo have oral medicines. There's a whole pipeline of they're just going to be flooding the market.
Well,
And
if you watch Hulu, it is drug after drug, row. All the commercials are just drugs.
yeah,
I mean, and there didn't used to be advertisement directly to the consumer. If you remember drugs, they were advertised through doctors, so that doctors were the ones making the decisions about and suggesting the drug. And now the patients come to the doctor saying, "I want this drug," and doctors will
yep,
usually just give it to them. So,
yeah.
yeah. Oh,
So it's good in a lot of ways because it's
yes.
helping and reaching a lot of people, but it's
Well, and
bad
it
in
is, yeah, and it is
other
helping
ways.
my daughter because
Yeah.
she doesn't have a diabetes,
No.
right? So she could not lose weight. Now she's lost weight, but she is looking forward to like just being done with it and then having her life back, right? Because in a way, well, right. So it is corporations that created these problems, and the Supreme Court has said that corporations have the right to poison us. That I'm not being hyperbolic.
I know.
If anybody wants to question, yes, the corporations have decided that liberty means that you cannot get in their way. And so they have said in court decisions that yes, poison, I mean, whatever, poop can be in drinking water. They literally have said this. So, so the good news is we're at, how does this connect to the collective? It does, right? So we are carrying this in our bodies. We
Hmm.
all are carrying it. If you're not drinking a lot of hot green tea to detoxify every day, man, you can't, there's nothing really much you can do except have really good boundary systems. And I'm talking about emotional toxins, everything, because it's everywhere.
And that
So
takes a lot of time. And we have engineered out that time to take care of ourselves.
that's right.
So people
So
just go on the way
now,
they are.
yes. Now, luckily, there's something happening. So the climax of all the dysfunction, the corruption, all of that is very cartoonish. Like it really are like it and the characterish nature of it and the acceleration of the corruption and the hoarding and all of that is an indication that there is another jump enlightenment that is going to come. We don't know what it will look like. It makes it very anxiety inducing for a lot of people, but that's why this path to self knowledge is really critical. And, in the end, that's your role, even with your patients, is to help them see that the answer is inside. And even as they're using the external to help them get there, that they cannot just walk out believing that because they changed their body, that that's the reason good things are happening, because it's not.
Yeah. Yeah.
So, yeah. Anyway, well,
Lots of work to be
oh
done.
my gosh, yes. And your patients are in Mayo Clinic is so lucky to have you as you figure out a way to sneak this in. And and also like you are different. And just by being different and we show up differently, we have a ripple effect that we don't really ever fully see.
And what has surprised me at how receptive patients are,
Mhm.
they can just sense it
Yeah.
and they will just jump right in and go with you and go with it,
Yeah,
which is,
surprising, right?
yes.
You're like, I don't know what they're going to think about this, but
And they're open.
they're
They're
way
just,
probably like you're connecting with their unconscious. The unconscious, like, yeah, yeah, yeah.
well, and another thing that's not great is almost every person I meet has had at least one horrible experience in healthcare where
Oh,
their symptoms have been dismissed. They've
oh,
been told, go lose weight and come back and then I'll help you.
oh my gosh.
Or if you could lose weight, you wouldn't be having this problem.
Yeah,
They're shamed and blamed. And same thing, back to the individual,
yeah.
take care of all this and lose weight and everything will be fine. And
Yeah.
I've seen cancers get missed,
Oh my God.
um, liver disease. I've seen lots of harm from that type
Yeah,
of situation. So when you sit with someone and you're open and you come with a new perspective, they're just so grateful.
yeah,
They're so
yeah,
grateful to
yeah.
be
Well,
treated like humans. Like you said, everybody deserves to be here and is that's enough. There's
right.
who you are is
Just
enough.
imagine when you really believe that. Because what happens is that when you believe that, like, I'm not here by accident, man. Like, consciousness created me. Like, oh, I deserve to have certain standards for myself. Because when you, I mean, after a while, you can't help it. You just get turned, the system turns you into a victim. And now you've given away your freedom of how to think. And pulling yourself out of that is difficult. It's difficult to admit that you're being a victim because
Yes.
it's designed, because the world relies on your believing that you're less free than you actually are. So that's what we want to impart, is that no, 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 no. Oh man, you got all the powers inside, and it starts with how you think. That's been hijacked. So Carl Jung is right. The future, the fate of humanity depends upon this self knowledge, this path to self knowledge. So, is there anything else you want to add? I mean, this has been great.
We've covered a lot.
Yes.
I think um it's probably good for today.
Yeah, we did cover a lot. And so I'm going to put it out there as one big long interview. It didn't go really it's like an hour and 15 minutes. And then I'm going to break it up, and I might break it up based on the topics. And that will increase the likelihood that more people will listen, and they could even pick like which topic that they might be into. So, and I'm also going to include all
Yes.
those books that you recommend.
I that's they're wonderful. And if people don't have time to read, look for the ebook, or you can't
Yes,
stay
or the
awake long
audio.
enough to read. That's what happens to me.
Yeah, or
Then
the audiobook. Yeah.
you can be yeah, the audiobook. You can listen anywhere, anytime, and then an insight will hit you and you have to run to your journal and write it down, make sure you capture it
Yeah.
or
Well,
re-listen to it.
what a great way to end. So I'm just going to read. So thank you so much for taking extra time to have this conversation that I know people are going to be really interested in. And I'm just going to say my little outro, which is thank you. And also, listeners and viewers, I hope you enjoyed this conversation with Gretchen Ames. And she's a wealth of knowledge and she comes at things from a different angle than me, but you can see how bringing whatever topic together with a depth psychology perspective just unleashes all these other ways to think. And it is really about our empowering ourselves and tapping into our own deeper source of wisdom, which then opens you up to, to the collective unconscious as well. So until next time.
Until next time.
Uh...